When you're working with an elderly client, 65 and older, you want to take special care to evaluate their health status. 90% of elderly have a chronic illness. Be sure also to inquire about medications and ascertain any special needs or concerns that they have and be able to modify your massage accordingly. Commonly used medications are cardiovascular agents such as anticoagulants, vasodilators, antiarrhythmics, ACE inhibitors, beta blockers, diuretics, and medications used to lower blood cholesterol levels. Common side effects of these medication includes bruising that may occur easily, orthostatic hypotension, which may lead to dizzy spells, severe or persistent muscle or joint pain. This is a common side effect and actually a very severe side effect of things like statin drugs and drugs that lower your blood cholesterol levels. Anytime your elderly client does complain persistent or severe muscle weakness or joint pain, it's important that they seek medical attention immediately. Another side effect of these medications is frequent urination. This is actually considered a therapeutic effect, not a side effect, but you need to factor this into your treatment plan as well. Very early in the session, you need to decide if your client is robust or frail. And oftentimes, you can just ask them about their physical activity level, if they exercise regularly and they do not have a disease that they're dealing with, they can receive a more vigorous massage. If they're more frail, you may need to go more gently, more slowly, and have a shorter session time. Some general massage guidelines for your elderly client that are very important is you need to be flexible with your scheduling times. Most elderly do not like to be outside past dark, so be sure that you schedule your appointment during daylight hours. They also may need assistance with the intake form. You may want to take it from them and ask them questions while you write down the responses on the sheet. Be sure to position your client for safety. This usually means lowering your table to make sure they can get on safely, having unobstructed human passage, also to limit or avoid the prone position because it's more difficult to breathe in the prone position. If they're in the supine position, be sure you elevate their upper body. And limit the times that they change position to 1 or 2. If you can't get them on the massage table for whatever reason, you definitely can massage them in their bed or on a sofa if you're massaging them at home, but the floor is not an option. You also want to consider reduced pressure. This is also the downward force and also the amount of sliding you do across the skin because we are dealing with skin that can tear in the cases of the frail elderly client. You want to limit your stretches and joint mobilizations to just gentle stretching and rocking movements. You want to avoid any extreme spinal mobilization. This includes the neck, especially in cases of osteoporosis and osteoarthritis, which many elderly people have. If your client is frail, you want to consider doing a shorter session. This may include 5 minutes of unhurried effleurage and deep breathing and gentle rocking, 20 minutes of focused work either on the feet, the legs, the back, the shoulders, and the neck, and your client will determine where the focus work needs to be. And then 5 minutes of closure work. Now, it's very common for an elderly client to have feet problems, so before you massage the feet, you want to be sure and inspect the feet. This means that if your client is wearing socks or slippers, you must obtain permission before removing them, and then be sure and replace them when you're finished. Be sure and avoid any unhealthy or suspicious looking areas. This includes the nails, and bring them to the attention of either the client and or the caregiver. Also respect their wishes to leave their socks on. You also want to guard against chilling. This may include the use of a blanket. Even when the client is clothed, you want to use a blanket or a sheet over the client. Table heating pads are a great idea. Just be sure you turn them off when your client gets on the table, so have them turned on about 30 minutes before you get started. The most common safety issue for people 65 and older is falling. So you need to do whatever you can to keep the client safe. And medications can alter balance and coordination and response time. And remember, orthostatic hypotension is common. If you remove eyewear from the client before you get started, be sure to replace them before you leave the room. And it's real important that because of the visual impairments, that you consider using table fabrics that contrast with each other, and perhaps they can contrast also with the wall and the floor colors. Before you leave the massage room, be sure to remind the client to sit up for a moment before standing, to move slowly rather than quickly, and to be able to help them if they need assistance. You must be patient and reverent with your elderly clients. Respect their slower pace rather than maximizing massage time. Be sure to allow extra time for the clients to undress, which is oftentimes layers and layers of clothing. Also, provide a transition time after the massage to hear a story or for them to express their concerns. Some elderly clients need to cry, to complain, or to convey fears. Make sure you provide some massage time for this as well. Research indicates that a social connection is key to health and happiness in the elderly. An ongoing relationship and focused attention from you, the therapist, can be a significant part of the life of the elderly.